Now it's time for Dr. Rachie Reports with Dr. Rachael Dunlop.
And I'm Dr. Rachie, and here we are at the free vaccine clinic at DragonCon 2010 in Atlanta, Georgia. And I'm here with Bill Atkinson. Hello, Bill. Welcome to the Skeptic Zone.
Welcome to Atlanta.
Thank you very much. Now, you are in immunisation from the Centers for Disease Control, the CDC.
That's correct.
You're an MD with a Masters in Public Health.
Yes.
And you helped to set up the vaccine clinic here at DragonCon.
Yes.
Can you tell me about your role in setting it up?
My job day to day is mainly training doctors and nurses how to give vaccines. I met Maria Walters at TAM and introduced myself, and she remembered me when she got back here and initiated the idea of doing a program like this. And I was the one who sort of knew the contacts who had the vaccine and the nurses and the skills to actually give it. So I was sort of the intermediary between the people with the idea and the people who are doing the vaccinating.
Right, so at the CDC your role is in epidemiology, immunisation epidemiology or vaccine epidemiology.
Yes, I have in the past worked in measles vaccine epidemiology, and now I primarily try to train doctors and nurses about vaccine. There's a lot of constant changes, as you know, in the vaccination realm, and so my job is to make sure that doctors and nurses in the U.S. are kept up to date on what the new recommendations are and what they should be doing.
And there's a good reason why we are here today in the vaccine clinic at DragonCon. There's currently an epidemic of whooping cough in California. Can you tell us a little bit about that? We've already had deaths of 7 or 8 young children. How bad is that epidemic at the moment?
We've seen quite a lot of pertussis in several states, California being the most notable. There have been 10, 15 deaths countrywide. What we're seeing is a lot of the cases have been in children, but they're being infected by their parents and their siblings and their babysitters. So we thought this was a good idea here because this is a lot of the age of the people that may have children at home, may have contacts with children at home, and thought this was a very fertile area, and likely a lot of these kids have not had pertussis vaccine before, or at least recently.
And the thing is, with the pertussis vaccine, it wears off after a number of years, right? So as an adult, you need to get a booster because you can be a carrier, but then you can pass it on to young children who are particularly susceptible. Is that right?
Absolutely correct. Probably most of us got our last dose of pertussis vaccine when we were 5 or 6, and it's only been since 2005 that we've had this new vaccine we could give to adolescents and adults. So it's a relatively new vaccine, and we hope it will make a big difference in pertussis both in the U.S. and elsewhere as well.
So who's the most susceptible to pertussis? We're talking about young kids, but we're also talking about people with immune suppression, are we? Who are the people that are most at risk?
Really anybody can be infected who hasn't been vaccinated recently. Adults, because of the size of our airways, tend to have fewer severe symptoms. They could be pretty sick, but it's mostly the really young children who have the most severe disease because their airways are very tiny and because they likely have not had all their doses of their pediatric childhood vaccine series yet. So we worry most about children. That's most likely to die, most likely to have very severe illness. But really any of us can cough it on anybody else if we haven't had a vaccine within a few years.
And how is it transmitted?
Transmitted by droplets, by respiratory droplets. When people cough, sneeze, talk, anything. It's a very efficiently transmitted bacteria, and it is very easily transmitted from person to person.
So what role do you think the low levels of vaccination are having in this epidemic, if any? Because I know that some people are now choosing not to vaccinate their children for all sorts of reasons, but some of this is to do with the anti-vax movement getting quite active in America. We have the same problem in Australia. Do you think that's contributed at all to these recent outbreaks?
It probably does. I think probably the bigger problem, that tends to be a fairly small proportion, except they tend to cluster together, folks who haven't been vaccinated. We think probably in the U.S. it's not more than 1 or 2% of people, but in some areas it can be much, much higher than that because they sort of have communities, if you will. And but the biggest problem, I think, right now is the fact that most adults and adolescents have not had a dose of pertussis vaccine for so long. So the kind of vaccine we're doing here is exactly, I think, what we need to do to raise the level of immunity in the population and help stomp out this outbreak we're having now.
So what's the response been like here in the clinic at DragonCon?
It's been very good. We didn't really know what was going to happen. This is the first time this has been tried, but we are probably going to use all our vaccine today. We came with 100 doses yesterday, gave almost all of them. Came with more than 100 today, and it looks like we're going to probably give out all those too. So it's actually been quite successful since we didn't really know what to suspect, but the uptake has been very good.
Yeah.
So we're very happy with the way it's turned out.
And so what kind of people have you been vaccinating? Are you talking about the people that you really want to target, which is the adolescents and the young parents, kind of? What's the sort of demographic that's been coming in? It looks like about half men and women, about half of each, and we have seen mostly, we haven't actually crunched the numbers all yet, but it looks like it's been people in their 30s, 20s, 30s, and 40s. It's who's exactly the folks that we were hoping to be able to vaccinate while we were here. So I'm fascinated by this, by the fact that you can actually do this bill, because in Australia I don't know if it's that common that you can this was set up by the Skeptics, as you said, Maria Walters, and they rented out a shop front and for the weekend and got you guys on board. And in terms of liability and health issues and stuff, that's already in place in America to do that sort of thing, is it?
It is. We do a lot of that in public health in the United States, and fortunately the state of Georgia and one of the local county health departments really have a lot of experience doing remote immunization operations. They had a protocol set up. They had the equipment and the people who are willing to come down and spend their weekend down here and volunteer. So we actually have a very good infrastructure. Some places are better at doing that than others. We got lucky. We have a very good group here in the Atlanta area that was able to come out and do this for us. And you see them sitting right back there.
They're behind us now.
And they've been busy all day.
They're very busy at the moment, but I noticed behind us also there's free HIV testing here. How do you conduct that?
It's actually a saliva test for antibodies, and that was kind of an afterthought. It turns out that the folks doing the HIV testing work in the same office as the nurses back there doing the vaccinating. So it was word of mouth, again, kind of right place, right time. Yeah. They said, well, we're going down. Would you like to come with us? And there may be some high-risk folks there. Lots of tattoos, lots of things, and they thought, good opportunity to do this, and really they've had a good response, even though we didn't really advertise this at all. They just kind of came and set up shop, and we just kind of let it run.
So what about the counselling sort of aspect of the HIV testing? Do you get a result right here, or do you send that test away and then?
It's done it takes 20 minutes.
Right.
It's all done right on the spot. We ask the person to come back. We won't email it or anything. We want them to come back and be able to counsel them as to what the results mean. Mm-hmm. We, interestingly, are using the dressing rooms for our little counseling offices.
Oh, I see,
you
right.
might have seen people going in and out of those little rooms. This was a former clothing store.
I see,
and they've been using the dressing rooms as the counseling rooms. So,
right, so the results for the HIV are given in the dressing room? And here, okay.
Right here, 20 minutes.
Interesting. Well, thank you so much, Bill, for joining us today.
You're very welcome.
I think this is a fantastic initiative. I don't know if we have anything like this in Australia. I wish we could have something like this. I don't know if you know, but we've had measles outbreaks recently, and we've had, Australia-wide, we've had pertussis epidemics as well. So we have similar problems to America in that sense, and I think this is a great thing to do.
Great.
Thanks for joining us today.
You're welcome.